Antibiotic resistance, a growing global threat. The overuse and misuse of antibiotics is leading to a growing problem of antibiotic resistance. Antibiotic resistance occurs when bacteria change in a way that makes them no longer susceptible to antibiotics. This can happen for a number of reasons, including overuse of antibiotics. When antibiotics are used to treat infections that do not need them, or when they are used for too long, it can select for resistant bacteria. Misuse of antibiotics. When antibiotics are not taken as prescribed, or when they are shared between people, it can also increase the risk of resistance, the spread of resistant bacteria. Resistant bacteria can spread from person to person, or from animals to humans. This can happen through contact. Antibiotic resistance is a serious problem because it can make infections more difficult to treat. In some cases, it can even make infections untreatable. This is a major threat to public health, as it can lead to a return to the days when common infections were deadly. There are a number of things that can be done to help prevent antibiotic resistance, including only using antibiotics when they are necessary. This means only using them to treat infections that are caused by bacteria. Taking antibiotics as prescribed. This means taking the full course of medication, even if you start to feel better. Not sharing antibiotics. Antibiotics should only be taken by the person for whom they were prescribed. Practicing good hygiene. This includes washing your hands frequently, especially after using the toilet or changing a diaper. We all have a role to play in preventing antibiotic resistance. By following these simple steps, we can help to keep this important medical tool effective for future generations. Here are some alternative therapies that can be used instead of antibiotics. Probiotics. Probiotics are live bacteria that are similar to the good bacteria that naturally live in your gut. They can help to keep your gut healthy and can also help to fight off infections. Bacteriophages. Bacteriophages are viruses that can kill bacteria. They are a promising alternative to antibiotics, especially for treating infections that are resistant to antibiotics. Antimicrobial peptides. Antimicrobial peptides are small proteins that have antibacterial properties. They are a promising new class of antibiotics that are less likely to cause resistance. Plant-based substances. Some plants contain natural compounds that have antibacterial properties. These substances can be used to make natural remedies for infections. Traditional Chinese medicine. Traditional Chinese medicine (TCM) has a long history of using herbs and other natural remedies to treat infections. Some TCM remedies have been shown to be effective in treating infections that are resistant to antibiotics. Furthermore, some herbal sources. In response to this growing problem, many people are turning to alternative medicines to treat their infections. Some of the most popular alternative medicines for treating infections include Echinacea. Echinacea is a plant that has been used for centuries to treat infections. It is thought to work by boosting the immune system. Garlic. Garlic is another plant that has been used for centuries to treat infections. It is thought to work by killing bacteria. Oregano oil. Oregano oil is a powerful antiseptic that can help to kill bacteria. Honey. Honey has antibacterial properties and can help to fight off infections. Conclusion. By using antibiotics wisely and by choosing alternative medicines that have been shown to be effective, we can help to keep this important medical tool effective for future generations.